Good morning, everyone, to this meeting of the Hampshire Local Outbreak Engagement Board. Can we start off on the agenda with any apologies, Marie?
There are no apologies received. All members are in attendance.
Thank you very much. Declaration of interests. The normal declaration applies. If you have a disposable pecuniary interest, any matters to be considered at the meeting, you must declare those interests and leave the meeting. If you have a personal interest and it's a matter to be considered at the meeting, you should make certain that you take regard of the rules regarding personal interests and consider whether it's appropriate to leave the meeting. But the full text of the Declaration of Interest is on the agenda. If you have any doubts, please read it carefully. Can we next move on to the minutes of the previous meeting? And I would like to first of all ask if there are any changes you want to make to those minutes, or if you're happy for them to be approved. Any changes at all? Okay, if you're happy to approve the previous minutes, the previous meeting's minutes, you don't have to do anything unless you are not in agreement with them. I can see no hands going up, so those minutes are approved. As far as I know, we have no deputations, Marie.
That's correct. There's no deputation requests received for this meeting.
Thank you very much. Moving on to item 5. I will be very brief. It's clear what's happening now is that there are increases across the southeast, as we saw on the news last night. They're variable, but probably it's correct to say in the eastern part of the southeast, particularly in parts of Essex and of course Kent and London, where the increases in the COVID virus are greatest. We are still in a lower area of increase compared with the rest of the southeast, but clearly, in case I forget later, I think what is important to note as regards the government's recommendations is whilst over Christmas there are opportunities for people to mix between generation and between households within the rules. In my view, that should only happen if you really want it to happen. That doesn't mean you have to change what you're doing, and you need to bear in mind that mixing different generations is an issue that you need to be very careful of, particularly indoors. And I suppose the only other point I would mention is I note increasingly people are encouraging everybody to wear masks, not only when they're indoors, but if they're in streets and the like. And on that rather sober note, I'm going to hand over to the Director of Public Health, Simon Bryant, to give a much more accurate, up-to-date and professional view of where we are. Simon.
Thank you very much, Councillor Mand. With your permission, I'll just share a presentation which was produced at the end of last week. Some things have changed, so what I'll do is I'll give you an update of the presentation and then give you the kind of various updates on the data and kind of the current data position, if that's all right. Is that visible to members of the board?
Yeah, it looks good to me.
So let's start off with the England picture, and you can see week 48. We can see we were in a really good position from week 47 in terms of the fact that we had less areas with higher rates. Over the weekend, we saw that position changing slightly, and so you can see, and I've got a picture later on that shows a more updated position, but we were going in the right direction. Sounds like, but across the southeast, we've seen that change particularly. And you can see again, this is the position at the 1st of December. Now the map isn't updated because that data has not come through, but we can see across the whole of Kent, those cases going up. really interesting. At the beginning, you remember there was quite a lot of noise around Tunbridge Wells, and those cases have gone up, and we're seeing increasing cases in Portsmouth and South East Hampshire, and I'll pick those up later in the presentation. And we've heard that both London, some parts of Essex and some parts of Hertfordshire have all gone up into the higher tier, and they've gone up overnight. And you can see the R rate there of the South East is between 0.9 and 1.1. It's likely that that is above 1 because we're seeing increased spread. So when we look at this graph, just really look at the pattern of the graph. You can see those cases going up and that steep rise earlier in the autumn, with England on the top, then Portsmouth, Southampton, Hampshire and Isle of Wight. So we're in a good position with regard to Hampshire. However, we are still seeing cases going up, with Portsmouth currently has the highest cumulative rate, and although it's slightly flattered in the last day, it's still going up. This is a graph that I created this morning, and shows that we have 19,847 cases across the pandemic. You can see here that what we saw in the early part of December was a lower kind of valley or trough, and you can see even with these unvalidated figures, we can see that that is actually going up again. So we need to be really mindful of that, and as Councillor Mann said, a somber picture in our patch. So again, looking at some of the 7-day rates, we can see that for Hampshire, our rate is 89.7, and that has gone up very slightly from a few days ago when it was in the 70s. Southampton at 79.2 and Portsmouth at 174. So again, a picture of concern, and we can see England at 173. So other areas in the country are coming down, whereas the southeast seems to be the place where it is going up the most. So I often give you the region with the highest 7-day rate. It is the southeast, and really from our perspective, driven by particularly around Kent, but also we are seeing increases in Surrey, Berkshire, Oxford, Buckingham. Hampshire and Isle of Wight is in a more favourable position. However, it is still concerning. You can see that uptick here for the Hampshire 7-day rate. And then across our districts, that variation there, and you can see that Rushmore, well, most of them are either kind of, they're not going down is probably the best way of putting it. So a really concerning position with regards to rates, with having the highest 7-day rolling case rate. If you can just hold that in your mind as we move through to the hospital activity, bearing in mind I've talked about Portsmouth. When we look at this 7-day rolling average for 60 pluses, again, it's a similar picture to the all age rate, but you can again see that Rushmore, Gosport and Havant are the areas that we're concerned about, but that sometimes will mask an increase in rate. So the case rate change is going up in all the districts, some quite considerably compared to others. If they're at a low base, obviously that jump means that it's a considerable percentage change, so really concerning. I couldn't find a more up-to-date graph from Public Health, a map from Public Health England, but it just again illustrates that kind of area of higher number of rates of cases in the southeast of Hampshire and Portsmouth, and again you can see Rushmore up there as well. So really concerning across our whole of our county, bearing in mind where we are and the position we are in. With regard to hospitalisations, we can now see the impact, and we heard in London that one of the reasons that they went into tier 3 was because of the pressure on the NHS, which is a really key concern. So we can see that actually it's come down in some areas, but with regard to London, it's been going up, and South East, it's been going up as well. And then when we look at the inpatient diagnosis, this is in Hampshire and Isle of Wight LRS, so our local area, we can see there's a steady increasing trend. Most recently, varies by NHS trust. We know that Portsmouth Hospitals is the trust with the most number of cases being admitted recently, and it's at risk of becoming overwhelmed. So we need a lot of work around that situation. And then just finally on the graphs, before I kind of bring a summary, we know that we are still seeing deaths, and we know there was 22 deaths. That's back at the end of November, so we'll see that going up, as we know it takes a little bit of time for the deaths to come through. And again, just to remind you, the burgundy colour is the COVID deaths, and the grey colour is deaths and others conditions, and we're under the 5-year rate. These are the indicators that we look at to see which tier we go into. That's a national decision, but also we can look at that locally so that we are cited on that. There are no rigid thresholds. It's really about a key set of indicators and how they interact with each other. Bear in mind the interaction of each of these together. So with regards to case detection rates, we have a lower tier. Age detection rates are rising, apart from Basingstoke, Test Valley and Winchester. Gosport haven't, Hart and Rushmore have rates over 100, and we know that our rate in over 60s is high, but Gosport and Rushmore are those areas with particularly higher rates. And we know we're seeing a steady and gradual rise, and in some parts of the country, nicely put on my team, rapid and sharper. So just thinking about that. And then our positivity, again, we want to have rates less than 5, and we have that except for Havant and Gosport, but again, something to be concerned on. And then that bottom paragraph there about the pressure on the NHS, being really mindful of those figures. And you can see, as I think Councillor Manns indicated, Maidstone, Swale, Canterbury, all those areas are putting some pressure on the NHS, which does impact on us in a ripple kind of impact. And then we need to think about the impact of the relaxation of the Christmas restrictions and what that might do. Bear in mind we're in that winter period, and we are also seeing winter illnesses as well, not just the uniqueness of COVID. So a lot of things playing in to our consideration going forward. Councillor Manns, I will stop presenting there, and as always, very happy to take questions on the data before we move on to key actions.
Thank you very much, Simon. The direction of travel is very clear, but I suppose if there is a bit of a silver lining to this, it looks as if the rates of increase within Hampshire are not as great as they are in some other parts of the southeast. And all we've got to try to do is to ensure that those rates don't increase to the point where it puts real pressure on our facilities, both in hospitals and indeed in other areas where we look after particularly the elderly. Ken, you had a question.
Thank you, Simon. I mean, obviously, the rates rising is disturbing because, as I alluded to over a month ago, it's like a tsunami coming down the country. My point is about compliance. I mean, I walk the streets of Basingstoke quite often. I was in Winchester the other week. Compliance in Hampshire is particularly good, if I could say that. Is there a Public Health England message or a public health message from Hampshire that can keep that up? Because it is, as Keith alluded to, it's about good compliance over the relaxation period, which will stop another spike in January. So is there something that could be done centrally on that?
You're absolutely right, Councillor Rattigan. Compliance is key there. I think we're all pushing those messages. We've had some very well received messages around Christmas, what's the gift you're going to give, let's follow the rules, and those kind of messages. I've also, because some of these changes have been kind of over the weekend, I think particularly around the southeast, we saw a rapid change over the weekend. I worked with comms, we've got a meeting today to really focus those messages on our areas of higher concern, so Gosport and Havant and Rushmore, but focusing across the whole county to make sure we really support and encourage people to follow the guidance, but also using that insight work to make sure that we kind of communicate in a way that meets the population needs rather than just put out a generic message. I wonder if we're going to see a slight change in emphasis of the national messaging around Christmas. I don't know, but I think, as Councillor Manns has said, we need to be really mindful of Christmas and the impact that could have on our cases of infection and the impact on the hospital going forward. So we're doing an awful lot of work, and our teams are prepared for whatever tier we come out in tomorrow.
Yeah, I entirely agree with Ken. I hope that we're people in our county and in our districts within the county are just being more sensible than perhaps one or two other parts of the country. To me, it is common sense, you know, to avoid other people outside if you can. I tend to wear a mask all the time when I'm outside, mainly to avoid me forgetting to put it on when I'm going in a shop, for instance. And the other point is, I think the intergenerational meetings, avoid those if you possibly can, because that to me is where things get out of hand, where elderly people get infected, and of course they're much higher risk, and I think that needs to be taken into account, as Simon says. Did I see another hand, or are we?
Councillor Mount, it's mine. I just wondered
yes,
if Laura Taylor wants to bring a bit of a district perspective from what's going on in the district, if that would be okay.
Yes, Laura, please. Thank you very much.
Thank you, councillors. I think it would just be helpful, just in support of Councillor Rattigan's comments there. Obviously, our district councils are really the feet on the ground with respect to maintaining that community spread of infection. And as you know, each district council was awarded some funding from the government to support Marshal and Ambassador deployment to help in our commercial areas. And we've done a piece of work, and I just wanted to assure the committee that all our districts have deployed staff, whether that's their core staff from their environmental health teams or community safety teams, to support our busy public areas at this time, to encourage both visitors, residents and retail businesses to continue to follow the rules in this run up to Christmas. And each district has done that differently as suits their place. A small village will have a different deployment to a large busy city centre. But of course, we're all working in an extended system here with the police, the county council, the district council, the NHS, and we're all very conscious of the big push we need to do for these next 2 weeks before we get to the Christmas break. Thank you, Chairman.
Laura, thank you very much. That's absolutely right. I was in Winchester at the end of last week, and it was very clear that I saw the marshals that were out in the streets, encouraging people to stay safe, to take common sense precautions, to avoid unnecessary contact. So I think that's a message we continue to give. I'm meeting up on Friday, as you know, with all the district leaders, together with the unitary leaders. I also had a meeting with the, well, it was the 4 unitary leaders, because we included Bournemouth yesterday. And I'm also meeting up with our members of Parliament on Friday as well, just to really get the same message over that Simon has got over. And I think generally speaking at the moment, although I think we have to wait a little longer to have that confirmed, the chances are that we will remain in tier 2 as an entity rather than any splits. Am I right in saying that, Simon? That's the direction of travel, but we haven't actually got the final decision on that yet, have we? That's
correct, Councillor Mans.
Yeah, that's certainly what I think. I understand the position in Kent, and I think that was absolutely right. I think the only area that we have to watch carefully, and that's where I know Simon is putting a lot of his effort into, is the southeast corner of the county and the two, particularly the 2 boroughs next to Portsmouth. But I know, speaking to the leader in Portsmouth, as you would expect, we're hoping that we can all stay in the same tier, if that is possible from a safety point of view.
And Councillor Mans, I think it's very illustrative by Kent, actually, that there was some noise about whether the one particular part wanted to stay in a lower tier, but actually we can see now that actually going in the same tier was really helpful, because all their rates have gone up, because as we know, our places are interconnected. So there's no point in kind of having part of a county going up and part not. So yeah. You're absolutely right, and we're working on that, and that's the view that I think is well held.
Mm. Any more questions? Ken, did you have another question, or is that a legacy hand?
No, I don't leave legacy hands hanging around. Could I add something in? We in Hampshire, obviously our rates look lower, but the places where they've risen very substantially, Essex, Kent, are commuter belts into London, and the fear I have is that London is the problem. Can we discourage our residents from going into London in any way we can over the next period of time? I think there is something to be said to lifestyle lists to say, actually, you shouldn't be going up. Is it really necessary? People have stayed away from London for a long time. Obviously, I know because my car park's empty on that commuter train. So I was wondering if there's a lifestyle message that we could put out either as districts ourselves or as a Hampshire LRF communication.
Simon, do you want to come in on that?
Yeah, Councillor Racken, you're absolutely right. The key messages are, don't travel unless you have to. We are really working on emphasising those, because I think, as we've seen, you're quite right. What we see with London particularly is that outer ring of boroughs in the main are the ones where the rates are going up. And I know there was lots of concern about London, particularly due to the hospital capacity. So yes, we'll take that on board and make sure that we follow that message up. And I think in general, don't travel unless you need to is the key one, isn't it? But particularly with London in tier 3 now.
Yeah, I think it's a good point, Ken, to discourage people from going to London unless they really need to. Now it's in tier 3, basically. Judith.
Thank you. Yes, I'd just like to come back to what Simon was saying about us remaining together as a one block with the cities, because there has been talk about perhaps the cities becoming detached from Hampshire as a separate area. But of course, there's so much in and out commuting from the cities, from Fareham and Gosport and Havant into Portsmouth, and from Eastleigh and Test Valley in and out of Southampton. And, the Southampton rates seem to have come down quite well and are now round about the same rate, 7-day rate as Eastleigh. So, I would support us all staying together. And of course, our hospital and NHS trust boundaries are not coterminous with counties and so on. So I think going any smaller may not be such a good thing. But we will wait and see what happens tomorrow. Thank you.
Thanks, Judith. Liz.
Thank you, Leader. I just really wanted to back up Ken. When I look at a map of Havant district, there is one area, Waterlooville, where everyone commutes into London mostly, and they are very high. And the other high areas are where people either commute into Portsmouth for work or they have social family connections. And I'm looking at Lee Park there and East Stoke and Hayling Island, where families do go backwards and forwards all the time. And yet other areas are quite low.
Liz, I entirely agree with that. That's exactly what I've noticed in the New Forest. Like the area that I actually live in is very low, but go across the waterside and it's a lot higher. But as Simon quite often says in the past, rightly, the more you drill down, you're actually looking at a particular outbreak quite often in a school or a business, which can come and go. So you get those figures moving around much more rapidly the further you drill down into them. I think I'm right in saying, Simon, I think you've just got to be a bit careful taking a snapshot when you get down to that level as to what the underlying trend really is.
And just to come back on Councillor Bear's point, you're absolutely right that we are looking at those trends. And when you look at those particularly those commuters and as you say, the connections in and out of Portsmouth, we can see those connections really strong with those parts of Havant, which is why we need to do some really specific comms around that. And the London commuting issue is challenging, because if it's for work, people are able to travel for work and should travel for work. And we know that's happening. So it's how we manage that. But you're absolutely right. We need to think really carefully about our messaging. And we are working very closely with Portsmouth City Council, because there's little point in us doing this on our own, as we're a kind of connected system, not just in terms of the hospital, but in terms, as you say, family connections and work connections, council affairs. So as we do that, we're doing that very carefully with Portsmouth to make sure we say the same messages.
Okay, are there any other questions at all? Are you all happy to take note. That's the recommendation of the report that Simon's given us. If you aren't, put your hand up. If you're happy, don't do anything. I see no hands, so we'll move on to the next item, final item, which is communications engagement. Judith, are you doing that one?
Yes, I am. If everybody's got the A4 landscape sheet in front of them, it's the same format as before, but the numbers that you'll see there aren't directly comparable to the previous reports, because this report is just for a 2.5-week period, not the usual 4 weeks, because of that extra meeting that we had. And it also only covers up to 1st of December, and I will be coming right up to date at the end of this report. So on the left, you can see the key themes covered, and the most successful posts were the Tier 2 announcement and the weekly data dashboard. So it's the new information that people are wanting, and also wanting to see what the numbers are. And over 10% of people viewing these posts were clicking through to the website for more information. The public and stakeholder engagement has continued with 47 inquiries handled around the Tier 2 test and trace and the financial impact of the epidemic. And you'll recall that we have dedicated COVID-19 web pages now, and there were over 66,000 views of these pages. Engagement with partners, including the districts, towns, parish councils, MPs and so on, has continued. We've been asking districts to share our comms with their local BAME communities, alongside an invitation to those communities to join a focus group so that we can get more information out to them. And on the right, you can see the continued support and messaging for high risk settings, focusing particularly on childcare bubbles and unpaid carers, you know, all of those grandparents who are carers and so on. Now, along the bottom, we've got a sort of new bit, which details the comms activity regarding the Tier 2 announcement, because it was very important that we got that messaging out there as quickly as possible. And we've tried and continue to ensure that we reach all of our communities with specific messaging to the community voluntary sector, faith communities, the BAME communities, which I've already mentioned, prisons, and the Gypsy, Roma and traveller contacts that we have, and particularly the districts have. And we're working, as Simon mentioned earlier, closely with our Insight engagement colleagues to make sure that we're achieving optimal targeting. Now, since the report was published, we've publicised the launch of the Connect for Communities project to tackle COVID hardship, the student travel window, and also we're encouraging people to shop local and shop safe. And the key campaign has been around Christmas bubbles and the rules around the relaxation of household mixing over the holiday period. So key campaigns running now include the best gift post, which I think is really lovely. Simon mentioned it earlier. We've also got the tier guidance, what we're calling the Yule rules, and the Stay Safe at Home this winter campaign, as well as repetition of the hands, face, space advice. And finally, we are ready with prepared comms for any tier change or no change announcement tomorrow. Thank you.
Judith, thank you very much. Before I ask for questions, I'm just going to mention something else, and that is the position of our schools, because that's been very much in the news this morning. And this to me is a really piece of really good news. I've got some of the figures at the moment. We have 93% primary school attendance in Hampshire, compared with 88 nationally. And we have 87% secondary school attendance, compared with 78% nationally. So those are both really encouraging figures. That's not to say that we haven't had outbreaks. We've had 329 schools that have been affected out of 540. 395 staff tested positive and 639 children and young people. But what is really encouraging is the liaison between the County Council and all our schools, regardless of status, has clearly been really first class, because each school is dealing, I think, and there's a graph that I won't put up because it's quite a complicated one, the advice they get and how they bring that down to a local level and decide the best thing to do for their particular school. And the results look pretty good. They seem to have dealt really well with the different outbreaks. So alongside all the other figures that Judith has given you, I just want to say at this point how delighted and how much I support and congratulate all our teachers and people involved in our schools for what they've done. It's a delicate balancing act between keeping people safe and ensuring our children get educated. And I see what's happening in London, and I'm very pleased that we don't yet at least have that situation here, that we'll get up to the end of this week where children will go home for the Christmas holidays and hopefully come back when we've got over this particular outbreak. So I just add that to the statistics that Judith's got, because I thought it's important that people generally know how well the system is operating to get our children educated and to keep them as safe as possible. Patricia.
Thank you for that, Keith. Yes, you're absolutely right. The schools have done a remarkable job, and I'd like to sort of remind people that our attendance figures are good, as you've already explained this morning, but we've been able to maintain above the national average attendance in all our schools throughout all the lockdowns so far. And I think that's a heroic effort by the head teachers in particular and all their staff, but also the teams across the whole of Hampshire, that, you know, our staff, the school staff, the ancillary staff, the Simon staff and so on, and the cooperation that we've had from all quarters. It's been amazing. That's really all I wanted to say. It's almost, dare I say, unique in the partnership and the working that we've experienced. There have been a few little bumps along the way, but they've been quickly ironed out. And the comms team and Simon's team have given tremendous support to us and the school. So thank you very much.
Thank you, Patricia.
Good travel record.
Very encouraging. Judith.
Yes, I didn't mention schools comms this time because I've done it in previous reports, but our comms team have been working and providing support to schools across the county to help schools with their messaging to parents and providing advice. And I really do want to place on record our thanks, my thanks to, I'm sure the board's thanks, to our comms department, who really have been working flat out. And I think we're seeing the good results of their efforts in getting the message out to not just schools but people across Hampshire. Thank you.
Thank you, Judith. Who else we got? No, that's your hand. There's no other hands. Anyone else got any questions at all?
Yes, it's Judy here. After
Judith. Oh, sorry.
No, not at all.
Your hand.
I just wanted to ask about comms, connection of comms in relation to the vaccination programme. Now, I know that the NHS is leading that, and there's very clear guidance on the NHS website, and there is some local information that's coming out today. I don't know if it's Simon or Judith, but I didn't know whether there was any connection in putting something in the comms about, if you need to know more about vaccinations, it's on the NHS website, or more locally where vaccination centres are being set up. I didn't know there was any positive benefit in having a connection with some of those comms.
Yeah.
So just asking
Judith, that's a very good point. Can I?
We will be doing that. In fact, we are doing that. I mean, at the moment, we are sharing NHS messaging as well. So, you're absolutely right on that. Yes, the programme is being managed and rolled out by the NHS, but we will be complementing their activity on getting the message out. I don't know if Simon has anything to add to that.
I'll let the Chief Executive come in first and I can follow up if need be.
Yeah, John.
Thank you, Simon. Thank you, Chairman. Just to reiterate what Councillor Grajewski was saying, we've said throughout that we want to put all of our energy into a communications programme which is going to back up what the NHS are leading on now in the critical vaccination programme. It does strike me, because I think the question is a really apt one, this is the engagement board, that what we might want to do, perhaps not for the next meeting, but for a meeting very soon, is to have a fairly comprehensive update from the NHS about the programme as it's going forward, perhaps at some point in January, so that we get a better grip through this engagement board about precisely how the programme is working and also what the partners can do to support the critical communications dimension too as well.
John, thank you very much. Judy, that's very apt. You're absolutely right. I listen into the discussion with Hampshire hospitals have with a couple of MPs every week. I would probably argue one of the issues that needs to be looked at quite closely to get it right is the logistics. I'm conscious of the fact that that most vulnerable part of our community, i.e. the elderly, and particularly that category that were previously shielded, are the ones that are going to probably have the most difficulty in getting to the place where the vaccinations are taking place. And so the logistics of that, I think, is something that all of us in local government, the districts and ourselves, will have to help the NHS, which are obviously leading this, but to achieve that. And I don't know, Simon, whether we've got any more information upon how you can mix the different vaccines when you're being vaccinated.
I haven't.
It's rather a fastball, because I've tried to find this out through various people within the NHS as to whether you can mix them or not, and I haven't really got a straight answer, but I'm certain we'll get one sooner rather than later. We'll
also say that only one has been licensed so far, so we haven't actually got that position. So actually we have got one vaccination we're using. So as the new one comes on board, we'll learn about that. And I think the vaccination news is really exciting. And one of the, I didn't give an update on the new developments, but it's not going to be the answer we need for this particular challenge of cases we're dealing with, because we vaccinated a very few people so far, which is brilliant news, and we just need to kind of keep that going for the next few months. And I think just to bear in mind that coming through to March will be more of a sustainable picture, and how those vaccinations interact we'll know by then, Councillor Mann. So I'm certainly onto it.
There's one other point since we're on vaccinations. Is there anything we could do as local authorities to encourage people to have the vaccination? I think that's something we might look at in our next meeting, because there's clearly a body of opinion in the caring sector that isn't necessarily totally supportive of this, whereas I think it's important that we actually lead where we can to demonstrate the importance of having the vaccination. Keith.
Yes, thanks, Keith. I think that if we see what's happening in some other parts of the world, notably in the United States, the common way of picking up some of this is actually community leaders being seen to be taking the vaccine. Now, clearly, we're not that far ahead in the rollout yet to be in a position to do that. But so, I mean, the American equivalent will be you, Keith, being filmed on BBC TV being jabbed.
Yeah, and I have no problem with that
kind of thing. All joking apart, that kind of thing actually is really powerful messages, given we know there are serious numbers of anti-vaxxers out there.
And I can say that is something that was discussed by the 5 leaders yesterday, doing precisely that. But I thought I would just, before, because I haven't spoken to Simon about that, but that is something that I'd be very happy to consider after Christmas. But I take the lead from our medical experts. But as a principle, I have no problem at all. Patricia.
Yeah, thank you. My concern is about the recruitment by the NHS of volunteers to undertake the vaccine. Now, to administer the vaccine I'm talking about. I have a friend who actually works in the NHS. She's not a nurse, but she is being trained to give vaccinations. And according to her, there is a campaign being held by the NHS to recruit volunteers, not necessarily trained nurses, but people who will undergo some training to administer the vaccine. Now, I haven't seen any of that communication, and I just wondered if anybody else has, and where or how is it being promoted? Simon, have you seen it?
No, I can probably answer it in two ways. I haven't seen the campaign. You're absolutely right. They are recruiting volunteers. They're from specific groups of staff. So I do wonder, and I don't know if it's done through their professional bodies and they're kind of targeting that way. But if you let me take that way, Councillor Stallard, I'll see what I can find out about how that is being promoted. They're also recruiting for volunteers in different roles around the vaccine, because obviously we need to have people who kind of book the people in and sit with them at the end. So there's a number of different roles that we're looking at. And then I think back to Councillor House's point about, we are the local outbreak engagement board. We do have a leadership role here, and that's absolutely right. And then how do we work and use our knowledge of our communities to work with the community leaders in those communities to help them spread that message, because we know that's going to be really important. And going back to Laura Taylor's earlier point about the COVID ambassadors, we've got a number of people who are doing these kind of roles. How can we move that forward and prepare for them to really help embed the vaccine in our communities so that actually we can take that forward? So a number of things we can do, and I think you're right, Councillor Mann, is in the early new year, linking back to Judy's point, actually let's really think carefully how we really push that even further, the good work we're doing with the NHS on Commons, but make sure it's really specific for our Hampshire communities. And I think we can do a lot of work there. So I'll take those points away.
Thank you very much, Simon. Has anybody got anything else at all? Are you all happy? Okay, well, we'll meet up again. We got our next meeting. Marie, we got the date of the next meeting. I think it's halfway through January, if I remember rightly.
Yes, I can confirm the next meeting is scheduled for the 20th of January at 3 o'clock.
Right, well, I'm certain we'll probably have a briefing before then. And obviously, over the Christmas period, I will keep close in touch with you, Simon, and others. And if there is anything specific that you feel we need to get together to discuss and to have a meeting either as a briefing or in public, we'll do it. Because I think, as I've said before, what's important is we don't just simply follow a very rigid pattern of these meetings. We are flexible enough to deal with things on the ground that happen that we need to take a view and give advice on. So next meeting formally is the third week of, or the third week of January, but I'm certain we'll be getting together before then, certainly after Christmas, and who knows, even during the Christmas break. Anyway, thank you all very much. If I don't see you again, happy Christmas and a safe Christmas. I should say a safe Christmas and a prosperous New Year. Thanks very much.
Thank you, Simon.
Cheers.